You know, every single day, there's just this avalanche of new scientific papers being
It's
published.
overwhelming, isn't it?
Totally, especially if you're in fields like, say, health economics or policy. Trying to do a comprehensive literature review, it feels like searching for a tiny needle in a haystack that just keeps getting bigger and bigger.
Absolutely.
Yeah,
It's a huge challenge for researchers just trying to stay current.
exactly. But what if there was a smarter way? A faster way to kind of sift through all that information?
hmm
Well, today we're diving deep into how machine learning is offering exactly that, like a real shortcut to handle this research information overload.
And the time savings are pretty remarkable.
Oh, you're not kidding. So let's unpack this. Our source today is a really interesting study from Applied Health Economics and Health Policy. It focuses on this specific open source machine learning tool called ASReview. And the big question they were asking was basically, can AI really streamline that initial part of a lit review, the title and abstract screening, which, let's face it, is often the most tedious, time-consuming bit.
Yeah, that's where a lot of the hours go. And what's really impressive here is the core finding. ASReview uses this approach called active learning.
Active learning.
Yeah, within a human-in-the-loop system. So the AI isn't just off doing its own thing. It actually learns from the human reviewer's input as it goes.
Okay, so it gets smarter based on what you tell it.
Exactly. It refines its understanding in real time. And the study found this tool identified, get this, a median of 97% of all the relevant papers
97%, that's high.
by screening only 25% of the total records. And this was in a big data set, too, over 10,000 unique entries.
Wow. Okay, hold on. Almost everything relevant found by looking at just a quarter of the papers.
That's right.
That's huge. And the
Hmm.
practical impact.
Well, this is where it gets really interesting. That efficiency, it translated into saving reviewers roughly 32 working days on just one literature review.
32 days, like a month and a half of work time.
Pretty much. Saved on a single review project.
Just think about that. What could you do with an extra 32 days in your research schedule?
It's an astounding figure. And, they tested this rigorously. They looked back, compared ASReview's performance against the old school manual screening method.
Right.
They played around with different amounts of prior knowledge, basically. How many relevant papers you feed the AI to start its training.
Okay, like seed examples.
Exactly. And different stopping rules. And a key thing they found was about consistency, using what they call the sampling criterion, where you decide up front, I'm going to screen X%, say 25%. That was much more reliable.
More reliable than what?
Then the heuristic criterion, which is where you stop screening after you hit like 10 or 20 irrelevant papers in a row.
Ah, I see. So setting a percentage target works better.
Much more consistent results. And interestingly, even if you started with a very minimal prior knowledge, just a few relevant papers, the AI learned pretty effectively and got highly accurate as it screened more.
So it really sounds like this isn't about AI taking over, is it? It's more about enhancing human researchers.
Precisely. It makes that goal of quick yet thorough knowledge gathering much more achievable. It turbocharges your expertise, essentially.
Yeah, supercharges it. But this efficiency, it must raise some bigger questions, right? Like about standards and guidelines.
Oh, absolutely. That's a critical point. While these ML tools are clearly powerful for efficiency, we need regulatory bodies and guideline setters, think PRISMA for systematic reviews, or HTA bodies like NICE over in England.
Right, the ones evaluating health tech.
Exactly. They're crucial for setting up clear, comprehensive guidelines. We need to ensure the quality, the transparency, the integrity of reviews done with AI assistance.
Makes sense. You need rules of the road.
Definitely. And you also have to consider that the level of accuracy needed might vary. A full systematic review often needs close to 100% recall. You can't miss much. But maybe a scoping review, which is more about mapping out a field, might have slightly different requirements.
Good point. So, okay, let's bring it back to the practical side. If someone listening wants to try a tool like ASReview, what are the key takeaways from this study, the recommendations?
Yeah, they're pretty clear. First, consider using that sampling criterion for your stopping rule. Aim to screen a set percentage for consistency.
Okay, like that 25% mark.
Well, the study suggests screening at least 25% seems to give good accuracy, so that's a good baseline. And second, make sure you give it some decent initial training data, at least 5 relevant papers, as prior knowledge seemed to work well to get the system started effectively.
Got it. Sample criterion, at least 25%, at least 5 starting papers.
That seems to be the practical advice coming out of this work.
This deep dive really highlights, I think, the incredible potential here. Machine learning isn't just hype. It can genuinely optimize the research process, making all this knowledge so much more accessible and timely for you.
It really could change how quickly we synthesize information.
Absolutely, it changes the game. Which leaves us with a big question to ponder, doesn't it? In this world of just ever-expanding information, what does this technology really mean for how we discover knowledge, how we ensure its quality, and ultimately, how we make informed decisions?
That's the million-dollar question, isn't it? Food for thought.